Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Brad Heineck, physical therapist.
Hi, I'm Chris the Pharmacist.
And I'm exactly one half of the Bob and Brad physical therapy. What are we? A channel, anyways.
Yeah, you're the dynamic duo.
But today we have Chris here. He's going to talk about, this is an interesting subject to me. He's going to tell you about if you can combine, I just dropped my.
We got stuff everywhere.
Ibuprofen and
Tylenol.
Some people think you can combine them.
You can actually, yeah. As a matter of fact, Advil makes an Advil Duo, which actually comes as a combo tablet.
You mean you can buy it that way?
You can buy it that way. So it's a little bit different strength than what you would buy in traditional, extra strength Tylenol bottles or like in your Advil bottle or ibuprofen. So separately, they come. Acetaminophen comes as a 325 milligram or a 500 milligram tablet.
Yeah.
And then ibuprofen always comes as a 200 milligram tablet. When you use Advil Duo, you have both the ibuprofen and acetaminophen in one tablet, it's 250 milligrams of acetaminophen and 125 milligrams of ibuprofen. And the theory behind that and the way that they market it that way is that you're using lesser amounts of both to still get good pain relief and keep it safe.
So studies evidently show that it actually works better.
As a matter of fact, there's a very prolific study with advanced dental or very severe dental pain, so tooth removal, where they just go in and pull her out. That when you combine ibuprofen with acetaminophen or Tylenol, you will actually get better pain relief than you would say taking a Percocet or a Vicodin, which is either hydrocodone with acetaminophen or oxycodone with acetaminophen, which are the narcotic pain relievers.
The big ones.
So the things that you can get addicted to. Right. So it actually gives better analgesia or pain relief.
Yeah.
So yeah, I mean, these days, most dentists will not give you pain medication.
Sure.
Because you can just do that.
Okay.
And they cost $4 a piece in bottles on the shelf of any pharmacy. You don't need to buy brand name anything, and you can combine them too. And we'll talk about the dosing.
Okay, so it's okay. You don't have to buy the manufactured combination.
No, you don't have to.
You can do it at home.
Yeah, the manufactured combination, Advil Duo, very convenient. So it kind of takes all the guesswork out of there for you.
I see.
So you can take 2 tablets every 4 to 6 hours apart. And so they'll tell you they don't want you to take any more than 6 tablets in a day is what their manufacturer guidelines are.
You mean per each one?
Yeah, well, no. If you're on Advil Duo, which is the combination of the Tylenol,
the
manufacturer, the commercially available product,
right?
Or if you're at home and you're like, well, I don't want to run out to the store. I feel horrible. I just had some bad dental work. I have ibuprofen on my shelf. I have acetaminophen on my shelf. Can I take the combo? And the answer is yes. And so basically, you can take 2 of your ibuprofen, which is 400 milligrams, and you can take 1 or 2 tablets of your extra strength Tylenol, which would be 500 or 1,000 milligrams.
Okay.
And you can use that combination 3 times a day. Safely.
Okay.
And it will give you excellent, excellent pain relief. So the only things that we really have to worry about, really, if you're on blood thinners, so because the ibuprofen can thin your blood. So if you're on things like warfarin, Eliquis, clopidogrel, Xarelto, these are prescription medications that are blood thinners.
And if you're on them, those names should be familiar.
Correct.
Right.
So your doctor would have warned you, your pharmacist would have warned you, your nurse would have warned you.
Sure.
So it's just something to be cognizant of, though. We have to be aware of that. As if you're coming in and asking a pharmacist, we're going to make sure that you don't have allergies, of course. Alcohol use. I mean, you don't want to have, if you're a heavy drinker, and what they classify that as 3 drinks per day. Things with acetaminophen or Tylenol in it could actually be problematic for your liver.
Okay.
So, and again, with certain blood pressure medications, sometimes the ibuprofen can be rough on the kidneys or create blood pressure issues.
Yeah.
So all things to be aware of. These are things that if there is any question, talk it over with your doctor, talk it over with your pharmacist to make sure that it's safe for you.
Sure.
But with respect to the dosing, so if you have severe pain and inflammation, so you really blew out your ankle, you had some rough dental work, the combination of Tylenol and ibuprofen is fantastic. And I'll also go a step further. It actually was a phenomenal fever reducer. Both the drugs acetaminophen and ibuprofen by themselves are good fever reducers. But if you've got a really sick child or you're very sick yourself, the combination will be better. It will allow you to feel more comfortable. It's going to control that fever, to allow you to rest and let your body's other natural processes to try and take care of that to get you some rest.
And if you've got an infant, you're probably not going to use this.
Yeah, well, you can, but it would be in liquid form with both, and we would dose it appropriately to the child's age.
And you're not going to, I wouldn't feel comfortable trying to dose it myself.
No, I would strongly encourage you to talk to your doctor or talk to your pharmacist so we can get you a correct milligram per kilogram dosage so that you can safely take care of your
So
child.
is that like under 2 years old or?
Yeah, well, yeah. I mean, it's going to be any kid. So yeah, it's going to be up on us. I mean, we've had kids that you have a severe ear infection.
Yeah.
They can be quite uncomfortable. High fever, just because that's what bodies do.
So we're talking 5 or 6 years old.
Well, even babies, 6 months.
Right, but
Yeah.
I mean, so
Yeah.
any age from 0
Any
to
child 0 to 12. I mean,
then it needs to
doesn't
be
matter.
adjusted.
Accordingly to body weight.
Right.
So we want to be real careful with
Yep,
that. So
okay.
12 on up, we kind of look at it more as an adult dose.
I see.
So we just,
Okay.
but we'll, make sure there's no interactions, no side effects, those-
And should they take this combination with food, empty
if you
stomach?
can, so that, if there's no nausea, like let's say in the work at dental work, so we would tell you probably something soft, so like some pudding or some applesauce, mashed potatoes, just
Sure.
something, soup, but have a little something in your stomach more than just a little bit of water, because ibuprofen inherently for some people can be damaging to the stomach lining.
Sure.
So when you're using the combination, we still have to take those precautions. So ideally, a piece of toast, some crackers would be ideal to protect your tummy, but the reality of it is that little something in there, and stay well hydrated. So those would be the big
Sure.
things too, because we want to take care of those kidneys.
Yep. So as far as price, I mean, is it a better deal to get the pre-manufactured combination?
Yeah, if you
or
get
buy it separately.
It'll be cheaper to buy it separately in most cases, but hopefully if we have pretty advanced pain where you need the combination,
Yep.
this hopefully is going to be a short-lived thing. So it comes down to convenience,
Yes.
or do you want to take 4 tablets of something, or do you want to take 2 tablets of something?
Sure.
So it's kind of a personal choice at that point. So some people are like, I don't want to mess with 2 ibuprofen, 2. Now I got a mouthful of this. And let's say if for dental work, mouth's still numb and you're trying to swallow, that's no small task.
Sure.
So it might be easier to buy something like the Advil Duo,
Yep.
where you can just take 1 tablet at a time and just get you get your second one down and you're good.
Is there a dual that's generic form?
Not yet. It's
Okay.
a very recent product. It was just released in the last 18 months or so.
Oh.
So it's not quite at that level yet
Okay.
for generic pricing.
All right. Well, that's good to know. Anything else we didn't cover?
Not really. So as long as we're not taking the blood thinners, we don't have the allergies to any components.
Sure.
We don't have renal disease. We're not heavy drinkers. I mean, those are going to be the big things. So you can always check with your doctor, your pharmacist, to ensure that it's safe and appropriate for you. But
Yep.
the reality of it is, excellent combination to relieve pain and
Wow.
inflammation.
Okay, that's good to know because we need to know if we're gonna.
Yeah.
You
Hey,
know.
we're there to take care.
All right. Very good.
All right. Thanks,
Take care.
guys. Have a great day.